Have you ever wondered if your body is trying to tell you something important? Prepare yourself to unravel the hidden messages of your well-being. Today, we're uncovering the 13 common signs of diabetes that every woman needs to know. It's time to tune in, listen, and take charge of your well-being like never before. Presently, more than 199 million women are living with diabetes, and this number is anticipated to rise to 313 million by 2040. Diabetes ranks as the 9th primary direct cause of death among women worldwide. The significance of addressing women's health concerns regarding diabetes stems from various factors, from subtle whispers in the body to unmistakable cues demanding attention. We'll unravel the mysteries of diabetes and its impact on women's lives. Join us as we navigate through the intricate web of symptoms, empowering you with the knowledge to recognize, understand, and take control of your health. As we explore this topic further, you'll soon discover that the human body is incredibly complex, often providing more information than we realize. Keep watching until the end to uncover signs often overlooked as simple body issues. The anticipation of which one it might be is sure to captivate you. Now let's dive right in. Holding to our last spot, number 13, slow-healing sores. Slow-healing sores are common due to impaired circulation, nerve damage, weakened immune function, foot problems, and hormonal influences. High blood sugar levels damage blood vessels, reducing oxygen and nutrient delivery to tissues and hindering wound healing. Nerve damage can lead to foot numbness, making injury detection difficult. Weak immune function increases infection risk, delaying healing further. Foot issues like corns and blisters can develop, causing slow-healing sores. Hormonal fluctuations during menstruation, pregnancy, or menopause can also affect healing. Regular foot inspection, proper care, and blood sugar control are vital for prevention and management. At the 12th spot, we delve into a subtle yet crucial aspect often overlooked: changes in mood. Changes in mood, such as irritability, may not seem significant at first glance, but they can serve as valuable indicators of underlying shifts in blood sugar levels. Increased blood sugar levels may result in feelings of fatigue and irritability. In contrast, low levels can lead to anxiety and confusion. Emotional stress, hormonal shifts, and lifestyle choices also contribute to the situation. Monitoring blood sugar, managing stress, and seeking support can help manage mood swings effectively. Spot number 11, skin changes. Your skin can reveal important clues about your blood sugar levels. Keep an eye on acanthosis nigricans, which present as dark, velvety patches in areas like the armpits, neck, or groin. This condition is linked to insulin resistance, a key feature of type 2 diabetes. Excess insulin can prompt rapid skin cell growth, resulting in noticeable patches. While skin changes alone don't confirm diabetes, they should prompt further evaluation of blood sugar levels, especially when combined with other symptoms. Down to spot number 10, unintentional weight loss is a common symptom of diabetes attributed to various factors intrinsic to the disease. Firstly, insulin resistance, particularly prevalent in type 2 diabetes, leads to the body's inefficiency in utilizing glucose for energy, resulting in heightened hunger and eventual breakdown of muscle and fat. Additionally, excessive urination, a hallmark of diabetes, causes fluid loss, contributing to weight reduction. Moreover, without adequate insulin, the body breaks down muscle and fat for energy, further precipitating weight loss. Notably, unintentional weight loss can serve as an early warning sign of diabetes, particularly discernible in type 1 diabetes, where insulin deficiency prompts rapid fat and muscle degradation. This phenomenon underscores the critical importance of recognizing weight loss as a potential indicator of diabetes, prompting timely medical evaluation. Spot number 9, increased hunger. Medically known as polyphagia is a common symptom of diabetes characterized by a persistent feeling of hunger even shortly after eating. When blood sugar levels are high, as in uncontrolled diabetes, the body's cells may not be able to absorb glucose for energy properly. This leads to a sensation of hunger as the body craves more energy despite consuming sufficient calories. Polyphagia can be particularly noticeable in individuals with type 1 diabetes, where insulin production is deficient, or in individuals with poorly managed type 2 diabetes. It's essential to recognize increased hunger as a potential symptom of diabetes and consult a healthcare professional for proper evaluation and management. Number 8 spot on our list, weight gain after menopause, is a common occurrence among many women. But for those with diabetes, it poses an elevated risk. Menopause triggers hormonal changes that can impact blood sugar levels, potentially exacerbating weight gain. The fluctuation in hormone levels, particularly estrogen and progesterone, can affect insulin sensitivity, leading to fluctuations in blood glucose levels. As a result, women with diabetes may experience challenges in managing their weight during this transitional phase. Furthermore, insulin resistance, a hallmark of type 2 diabetes, can become more pronounced with age and hormonal changes associated with menopause. This resistance impairs the body's ability to effectively utilize insulin to regulate blood sugar levels, contributing to weight gain. Excess weight, especially around the abdomen, further exacerbates insulin resistance, creating a cycle that predisposes women to both weight gain and diabetes complications. Number 7, blurred vision. Blurred vision can surprisingly be a subtle indicator of diabetes, significantly when blood sugar levels fluctuate excessively. It can impact the eyes by affecting the lens's ability to focus correctly. Here's how it happens. Excess sugar in the bloodstream can draw fluid from various tissues, including the eyes. This can temporarily alter the shape of the lens, leading to blurred vision for many women. This sudden blurriness can be unsettling and may come and go with changes in sugar levels. While it's a reversible symptom, it's essential not to ignore it, particularly if it persists or recurs. Blurred vision, especially when combined with other diabetes-related symptoms, might indicate the necessity to monitor your blood sugar and ask a doctor for help. Spot number 6, fatigue. Fatigue refers to a persistent feeling of weariness or extreme tiredness beyond simply feeling tired after a hard day's work or due to lack of sleep. Feeling constantly tired can be an indication of diabetes. When blood sugar is high, it's harder for the body to move glucose around, which cells use for energy. As a result, even after a whole night's sleep, women may feel drained or lack the power to engage in daily activities. Persistent fatigue, particularly when accompanied by other symptoms, may suggest undiagnosed diabetes or difficulties with blood sugar management. While fatigue alone is not enough to diagnose diabetes, it is a symptom worth paying attention to, especially if it is unexplained and persists over time. Before we proceed to the top 5 common diabetes signs for women, if you found this video helpful, we would greatly appreciate it if you could click subscribe and hit the notification bell for more diabetes insights. Thank you. Holding the spot number 5, difficulty conceiving is a common challenge for women with diabetes due to its impact on reproductive health. Diabetes can disrupt ovulation, menstrual regularity, and hormonal balance, reducing the chances of conception. Elevated blood sugar levels might impact the quality of eggs released during ovulation, while complications like neuropathy and vascular damage can affect the uterus and cervix. Getting guidance from a doctor is essential for women experiencing infertility related to diabetes. A thorough evaluation can identify underlying factors contributing to infertility and guide appropriate treatment options, including optimizing blood sugar control and addressing complications. Timely intervention and proactive diabetes management can increase the likelihood of getting pregnant and have a healthy baby. Early consultation with a healthcare provider is essential for addressing fertility issues and increasing the likelihood of successful conception for women with diabetes. Spot number 4, excessive urination. Frequent urination and unexpected nocturnal bathroom visits can be a notable indication of diabetes when there's an excess of sugar and glucose in the bloodstream. The kidneys labor to filter and absorb glucose, but when they're overwhelmed, the surplus glucose is expelled through urine, drawing fluids from tissues. This mechanism triggers heightened thirst and, consequently, more frequent urination for many women. It may feel like an endless cycle of drinking fluids and rushing to the restroom. However, it's not merely a quirky hydration habit if you find yourself caught in this pattern. It could be your body's way of signaling elevated blood sugar levels. Combined with other diabetes symptoms, it merits a prompt discussion with a healthcare provider. Spot number 3, yeast infections. Yeast infections may indicate more than a bothersome issue, especially when they recur. For women, yeast thrives on sugar, and when there's excess sugar in the bloodstream common in diabetes, it can also accumulate in the vaginal area, creating an ideal environment for yeast growth. Consequently, women with elevated blood sugar levels may experience more frequent yeast infections. So, if you find these infections occurring more frequently or proving more challenging to treat than usual, your body could be signaling elevated blood sugar levels or even undiagnosed diabetes. Not everyone experiencing recurrent yeast infections has diabetes, but the association is significant enough to warrant attention and perhaps a medical evaluation. Holding on spot number 2, polycystic ovary syndrome, commonly known as PCOS, is a hormonal imbalance that predominantly affects women during their childbearing years. It often disrupts menstrual cycles and can lead to increased facial and body hair growth due to elevated levels of male hormones. Here's the catch. Many individuals with PCOS also experience insulin resistance. This means their cells don't respond effectively to insulin, prompting the body to produce more insulin to compensate. This excess insulin production can stimulate the ovaries to release even more male hormones. Therefore, women with PCOS face a dual challenge. Effectively handling PCOS and staying attentive to the risks of diabetes is vital. Awareness is important in addressing these issues. Now at the top of our list is urinary tract infections, UTIs, which can affect any part of the urinary system and are prevalent among women. But what's the link to diabetes? Elevated sugar levels in urine create an ideal breeding ground for bacteria, heightening the risk of infections in women with diabetes or consistently high blood sugar. While UTIs alone don't confirm diabetes, persistent or recurrent UTIs may indicate elevated blood sugar levels. If you are grappling with frequent UTIs, you must diligently monitor your blood sugar levels and talk to a doctor for help. So there you have it, folks. Spotting the 13 common diabetes signs in women is essential for getting help early and managing the condition. Women must tune into these signs and consult with healthcare professionals when they emerge. Early detection not only helps manage diabetes more effectively, but can also prevent potential complications. Thank you for watching. We trust you found this video informative and valuable. Remember to subscribe to our channel for additional insightful content about diabetes. If you have any questions or topics you'd like us to cover in future videos, please leave them in the comments below. Thank you, and see you in the next video.